Coronavirus is spreading across Brazil in increasing numbers. The country is second to only the United States in total cases and deaths. More than 1.5 million have come down with the virus in Latin America's largest country. The number of confirmed cases is rising by more than 35,000 people every 24 hours. More than 1,000 people are dying each day. Over 60,000 deaths total. Researchers at the Pelotas Federal University say because of underreporting and a lack of testing, the real figures could be 7 times higher. Why is it so bad? There are many reasons, but most of them begin and end with this man, far-right President Jair Bolsonaro, the so-called Trump of the tropics.
We've just passed China in the number of deaths from coronavirus.
So what? I'm sorry. What do you want me to do? My middle name is Messiah, but I can't do miracles.
He's a former military captain, a staunch ally of President Donald Trump, and he has actively fought social restrictions since the pandemic arrived to Brazil.
70% of the population is going to get sick. If it's not today, it's going to be next week or next month. We have to be a little careful with the elderly and people with health problems. Everyone else has to be careful too, but you have to work.
He's flaunted measures meant to fight the virus, greeted supporters without a mask, and joined protests against quarantines weekly in Brasilia. Now it's caught up with him. On July 7th, Bolsonaro announced that he had tested positive for COVID-19. He still says the virus is not a big deal. He has long held that social restrictions are really just a guise to take down his government by tanking the economy. Bolsonaro, like Trump, needs enemies to keep his supporters fired up, and he digs up a new one daily. He's jousted with state governors, the press, Congress, and the Supreme Court. He's forced out 2 health ministers before finding an ally in current interim health minister, Army General Eduardo Pazuello, who has no health experience. Pazuello has joined Bolsonaro at protests against quarantines, and in May authorized the widespread use of chloroquine and hydroxychloroquine against the recommendation of Brazil's health community. While many of Brazil's neighbors, such as Argentina and Venezuela, have remained on lockdown, successfully flattening the curve, Brazil has been imploding amid political infighting, turmoil, and a disjointed and piecemeal response to the crisis. The problem, like in the United States, is that there has been no federal cohesion. The bulk of the response has been left to the state governors, who battled with Bolsonaro for weeks over quarantines and lockdowns. The country has had the potential to fight the pandemic, the largest number of respirators per capita in the region, world-class experience in battling tropical diseases and outbreaks of measles, malaria, dengue, and Zika in recent years, a widespread and free universal healthcare system that is used by at least 70% of the population. But Brazil's healthcare system is not spread equally around the country, and mixed messages from the top calling on people to disobey quarantines have helped to confuse and distract, allowing the virus to spread further and more quickly. Some believe this is actually Bolsonaro's goal. Military General Antonio Manuel de Barros, in charge of the Venezuelan refugee mission in the northern state of Roraima, actually ordered his troops to try and get infected in order to achieve herd immunity.
We are not infected. We are being immunized for future actions.
More than 83,000 healthcare workers have come down with the virus, according to recent government figures. The healthcare systems in numerous states have bordered on collapse. The hardest hit areas are in Sao Paulo, Rio de Janeiro, and the poor north and northeastern states, which lack resources and infrastructure. Amazonas has been ground zero. The state's only ICU units are located in the capital, Manaus. The images of coffins being buried in mass graves have become iconic symbols of Brazil's war with COVID-19. Over 400 members of indigenous tribes have died. 10,000 have come down with the virus from 119 tribes. The numbers continue to climb, leading many to fear that we are facing a potential genocide.
The peak of the disease has passed in Manaus, but the disease is spreading into the interior. And now it's going to hit the municipalities, the river communities, and the indigenous.
Meanwhile, illegal loggers, miners, and land grabbers continue to invade indigenous territories amid a complete lack of government oversight. Brazil has one of the highest rates of inequality in the world. Even before the pandemic, poverty had been rising for several years. Many are concerned for the impact of the pandemic on Brazil's poor and working classes. Millions live in the densely populated poor favelas or slums surrounding the country's largest cities. The most iconic of these favelas are in Rio de Janeiro. Here, many live without access to basic sanitation and running water. Brazil treats less than half of its sewage.
That's right. There's no water to drink. There's no water to cook with. There's no water to wash with. Our clothes are covered in mildew. We had to throw most of it away because there's nowhere to wash it.
If the coronavirus wasn't bad enough, the country's military police have battled drug traffickers, leaving residents to fend for their lives and clean up the mess. In mid-May, special ops raided Rio's Complexo de Alemão favela, shooting up the neighborhood and killing 13 people. Residents who should have been socially isolating had to dispose of the bodies. 8 states, including Sao Paulo and Rio de Janeiro, have been lifting quarantines and opening shopping malls and businesses despite the rising cases and the fact that Brazil has yet to hit peak. Even the head of the World Health Organization says it's hard to predict when this might be.
We need testing en masse and contact tracing of the infected population. That is the only way we'll be able to make decisions to mitigate and contain the virus.
A recent Oxford study said Brazil has been reopening its economies too fast, too soon. This came after Bolsonaro signed a long-awaited $11 billion COVID-19 federal relief package for states and municipalities.
This is the largest relief package from the Brazilian government for the states and municipalities in the history of the country.
Many analysts believe the funds came with strings attached, namely the condition that the states begin to reopen their economies. Meanwhile, the president has been jostling for increasing control of the federal police in order to protect his family and friends, as he said at a cabinet meeting in April. Bolsonaro's 3 politician sons are suspects in a series of federal police investigations, including embezzlement, money laundering, and involvement in a network of fake news. And the virus shows no sign of letting up. As Brazil enters winter, most Brazilians are just trying to hang on amid the pandemic and political turmoil. For The Real News, I'm Michael Fox in Florianópolis, Brazil.